Hello, I'm Jesus Damian Blasco Garcia, a PhD student in the Aging and Fragility program at the University of Murcia, and I enjoy a research staff training scholarship from the Seneca Foundation. Before continuing, I would like to point out some key facts published by the World Health Organization. In 2020, the number of people aged 60 years and older outnumbered children younger than 5 years. And the pace of population aging is much faster than in the past. Against this background, the question that we must ask ourselves is whether our health and social systems are really prepared to face this challenge, and if, as engineers, we can propose technological solutions that contribute to improving this situation. My doctoral thesis has been inspired in this context. It is titled Contributions to the Development of an e-health Platform for the Monitoring of Older Patients with Cognitive Impairment using Artificial Intelligence and Cloud Computing Techniques. There is a lot of useful information about persons' physical and cognitive state that can be captured through the use of sensors. An example of an application we have worked on consists of assessing the risk of suffering a fall using a camera. In fact, falls are the second leading cause of unintentional injury deaths worldwide, and adults older than 60 years of age suffer the greatest number of fatal falls. The system we have developed is capable of capturing fundamental parameters to measure the balance and the gait that can be comfortably analyzed by a therapist, and even opens up the possibility of establishing alerts if a person exceeds certain risk thresholds. Also, cognitive simulation exercises have been carried out through the screen of a mobile robot, and the attention paid by the participants has been measured. In this sense, it should be noted that we should never lose sight of the end user to whom all these solutions are directed. After carrying out several tests in the real environment of a residence, we have verified how the digital divide directly affects the ability of residents to interact with a screen. This is something that we have easily solved by incorporating natural language, such as voice commands or the interpretation of body movements. The use of brain-computer interface also represents a great advance to improve the early diagnosis of cognitive impairment and measure the time evolution of older people. In this case, it's important to opt for solutions that are as minimally invasive as possible, and that the information provided is legible for therapists. All in all, we note that it is possible to obtain a lot of useful information, but it is not only important to acquire that information, but also to store it and present it appropriately, as well as that all the sensor data is aligned. That is, if the user is performing a cognitive simulation exercises, both the information from the camera that records his/her attention and the associated EEG signal must be obtained for each timestamp. However, if healthcare is truly to be improved, solution must not only be focused on patients and their needs, but also on real usefulness to therapists, in such a way that it's not a waste of time but an investment of it. A health platform that can gather information from a set of sensors necessary to make an early diagnosis and minimizing the human and material resources necessary to collect them, along with an adequate presentation of results for health specialists, would be a great tool to improve healthcare for our elderly. Furthermore, the storage of this data opens the possibility of applying artificial intelligence techniques to automate the diagnosis process and detect patterns.